I will say I'm a proud ambassador for the foundation since 2024. And I experienced severe postpartum depression and anxiety both times. I have two daughters. First, it was during residency, the second time as an early career physician. One of the most visceral responses I had in that pit of darkness, and that included thoughts of suicide, which I continue to not talk about that up until last year. Like, this is how long it actually took me to even talk about it. Was this fear of being discovered, the fear that my image as a perfect physician is going to be tarnished because I would have to report it everywhere, that my credibility as a doctor would be in question. So I lied on my depression screenings. Things got really dark before I sought help, and I'm so glad that I did. And I'm here today to have this conversation with you as an ambassador of the foundation. I feel like I finally found the language to share this story and channel it for impact. When you were talking about Lorna, I mean, you heard these stories now, that floodgates that opened 3 years after. Can you explain how licensing and credentialing questions have actively prevented healthcare workers from seeking help and what the
Absolutely.
foundation is doing regarding
Absolutely.
this?
And I just want to thank you for sharing your story. Our chief medical officer shares her very similar story that she had because she had children during her residency and had to hide her postpartum depression. We hear this from everybody because, as it turns out, clinicians are human and you are susceptible to the same conditions, whether those be mental health or physical health conditions that anybody is. And it's an incredible injustice that you are not able to get mental health treatment. And let's talk about that for just a second, because for me, as somebody who was a non-clinical healthcare leader, the issues that Lorna was talking about for me, as someone who was that close to it, were a shock. And so for someone who's not in healthcare to hear you can't get mental health treatment, you prescribe it all the time. What do you mean you can't get it yourself? Let me go into it a little bit. So healthcare workers have to navigate a minefield of questions about their prior mental health treatment and diagnosis throughout their career. It begins, frankly, when they apply to graduate school, for medical school or nursing school. They often are asked questions about their mental health and often encouraged not to disclose anything about their mental health in that application process. Um, you get a license in a state. When you apply to get a license in a state, the licensing questions may ask you inappropriately, have you ever gotten therapy? Have you ever been treated for a mental health condition? Shockingly, those questions are often listed in categories that you would refer to as moral fitness categories, like, have you been convicted of a felony? Have you gone to mental health treatment? Like, in that order. And so there's a real message that those questions send, even the way that they're listed and where they're listed, that getting mental health treatment is not okay. So then you get that license, and then you need to go to work in a hospital system. To do that, you need to apply to work in that system, and that's called the credentialing process. And that process is a similar kind of a vetting, and they ask very similar questions, but they don't just ask it of you. They ask it also of your peers. They ask those same or more invasive questions. Have you ever known Amna to have X, Y, or Z? And they're very gray in the questions, and they're very broad as well. And so that's another layer. You wanted to get paid for your work. Did you, Amna? Okay. You need to apply to get credentialed by an insurance company so that they can pay you. Similar set of questions. Oh, you wanted malpractice insurance. Similar set of questions. So the questions go on and on and on, which is why I say you're navigating this minefield of questions. And it continues to reinforce the message that you have, which is it's okay to take care of others, but you're not really allowed to take care of yourself. And what we need to recognize in all of that is the fallacy is that you would have been a better clinician if you had been getting treated for mental health when you needed it. It is actually unsafe, not just for you, but also for patients, for you to be ill of any condition, frankly. We want our healers to be well.